Dr. Sankar Das Mahapatra, consultant gynaecologist in Bhagirathi, Neotia Women and Child Care Center, Newtown, Rajarat, Kolkata. Today my topic is endometriosis and its effect on infertility. What is endometriosis? Endometriosis is an enigmatic disease which affects the 30% of women in childbearing age, around 15 to 45 years of age. It is a very frustrating disease which affects the woman, and it is very frustrating to the doctor also. But one thing we have to know, it is not a cancerous condition, but it is epidemic. What is the etiology of endometriosis? Why it occurs? Endometriosis by definition is presence of ectopic endometrium outside the uterine cavity. It may be in the pelvis, it may be in the rectum, in anywhere in the abdominal cavity. So, what is the causes? Exact etiology is unknown, but most common accepted etiology is retrograde flow of menstruation. During the time of menstruation, menstrual blood will flow to the abdominal cavity, and due to our normal mechanism of body, these endometrial cells are cleared by your body defense mechanism. But in case of abnormal patients, these endometrial cells are proliferate and causes adhesion, and sometimes it will bleed inside the cavity and cause adhesion formation inside, and there is fibrosis inside the pelvis, so that there is pain in the pelvis. So main symptoms are, due to this bleeding, there is pain during the menstruation, there is pain during the intercourse, there may be pain during defecation, and sometimes it leads to infertility. It may not be serious to other patients, but in patients with endometriosis, it is a very serious condition, because it always associated with severe pain during the time of menstruation. And when women strive for pregnancy, he fails to achieve the pregnancy, and there is always pain during the time of intercourse. Is it not serious? When the patient tries for infertility, he will not fail to become pregnant. Every time during the time of menstruation, there is severe pain in the abdomen. So it is a very serious condition to a part of woman. And day-to-day activities of the woman is totally disrupted, and his family life also totally disrupted. And also doctor also very frustrating, because every time patient come to the doctor with severe pain. How do you know that I have endometriosis? So first thing is that when patient has pain in the lower abdomen, they usually consult with the general physician. In general physician, they will give some medicine for analgesics. There is some relief, but it is not permanent. After 1 or 2 years, patient again come back with pain. We will give oral contraceptive pill. After that, 2 to 3 years, there is some relief of pain. But after 2 to 3 years, when the patient come to the gynecologist actually diagnose it is a case of endometriosis. Then it is very late. Because if we take a proper history, there is pain during the time of menstruation, there is patient fails to achieve fertility, and there is pain during intercourse. And we did the clinical examination and followed by some ultrasound examination. In this way, we diagnose the patient, he is a patient of endometriosis. So the exact treatment we can start for that patient. In some advanced cases, we advised MRI so that we can find out the lesion that is deep inside the pelvic cavity. But laparoscopy is the gold standard to diagnose the endometriosis in all patients, whether he is come with pain or with infertility. How do you treat the endometriosis? So proper diagnosis is very important for treatment of endometriosis. After diagnosis of endometriosis, if the patient's symptoms are very mild, we give the oral contraceptive pill cyclically, so that patient will not bleed inside the abdomen, and there is less stimulation by the hormone, so the patient gets some relief. But in advanced cases, we give injectable progesterone preparations like Depo-Provera, and sometimes we give GnRH analogs that will cause some relief of pain. But in advanced cases, we go for laparoscopy, excise the endometrial lesions, especially the endometriosis that affects the peritoneum of the pelvis, and also uterosacral ligament, rectal nodule, and so and so. So the pain will be relieved. But in infertility patients, we will not do such a advanced treatment. We will do whatever is desired to do for the fertility. But we actually treat the patient, we counsel the patient properly, because some patients comes to us with pain. In these cases, we actually do laparoscopy and excise the all endometriotic tissue so that patient will relieve. And in case of infertile patients, we actually do the surgery as much as required for the patient, followed by some medical treatment. So, what are the take-home message for the endometriosis? It is not a cancer, so it will not kill you. But only treatment by medicine, it will not suffice. So, in patients with infertility, ovarian stimulation with medical treatment or IUI is the choice of treatment. But in patients with pain, severe pain, laparoscopy of the treatment, because laparoscopy is the gold standard in patients with endometriosis. We actually offer the patient a holistic approach. We counsel the patient properly first. What his primary goal is. If his primary goal is pain, then we treat the patient for pain. We treat the patient for disease, for the relief of pain. That is excision of the deep endometrial tissue, and that is maybe pelvic peritoneum, maybe uterosacral ligament, maybe rectal nodule, and so and so. But in case of infertility patients, we actually treat the patient whatever she requires. In these cases, we give the treatment, and either we give the medical treatment after the surgery in fertile patients, or we send the patient to IVF.